Hello, everyone. Welcome to a series podcast where we dive into everything healthcare. I appreciate you subscribing to the channel, and if this is your first, please click the subscribe button below to stay updated with our latest episode. I'm your host, Sonny Clement. Today, we're going to be discussing a very serious topic. It's real reasons medical workers are leaving Nigeria. There are several reasons why medical workers are leaving Nigeria for developed countries. The phenomenon, often referred to as brain drain, is driven by a combination of economic, professional, and personal factors. In this episode, I'm going to be sharing with us 8 reasons why medical workers are leaving Nigeria in Europe.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.
Number 1 is economic factors. Medical professionals in Nigeria often receive relatively low wages compared to their counterparts in developed countries. This disparity makes it difficult for them to achieve financial stability or provide for their families. In some cases, medical workers face delays in receiving their salaries, further exacerbating financial stress and instability. In developed countries, often significantly higher salaries, better benefits, and opportunities for financial growth, which are attractive to a lot of Nigerian workers, Nigerian medical workers. Number 2 is working conditions. Many Nigerian healthcare facilities lack the necessary equipment, supplies, and infrastructure to provide quality care, leading to frustration among medical workers. Sometimes there's overwork and burnout. Due to staff shortages and the high demand for medical services, healthcare professionals in Nigeria often work long hours with heavy patient load, leading to burnout and stress. Sometimes it's very unsafe, for them to work. In some cases, medical workers face unsafe working environments, including exposure to infectious diseases without adequate protective measures. Number 3 is professional development and career opportunities. Looking at the area of opportunities for advancement, which is currently limited, there may be fewer opportunities for career advancement, specialized training, and professional development, which can hinder the growth and satisfaction of medical professionals. Better training and education opportunities abroad when compared to Nigeria. So this can be another reason. Developed countries often offer more advanced training programs, research opportunities, and access to cutting-edge medical technologies, which are appealing to medical workers seeking to enhance their skills and knowledge. Political and social factor is another reason. Ongoing security challenges in some parts of Nigeria, including violence, terrorism, kidnapping, contribute to the unsafe environment, prompting medical workers to seek safer living and working conditions abroad. Corruption and mismanagement is another thing. The perception of corruption and poor governance in the healthcare sector can lead to disillusionment among the medical workers, driving them to seek opportunities abroad with more transparent and efficient system. Quality of life is another thing. Developed countries generally offer higher standard of living, including better housing, better healthcare, education, and public services, which are attractive for medical workers and their families, especially. Then the idea of work-life balance is missing. Is missing by design, unfortunately. Here, the ability to achieve better work-life balance with reasonable working hours and time for personal and family life is a significant factor for many medical workers choosing to migrate. Number 6 is social and professional recognition. In some cases, medical professionals feel that their expertise and contributions are undervalued in Nigeria. In contrast, they may receive higher social and professional recognition in developed countries. The prospect of working in a more supportive, professional, and less hierarchical environment is appealing to many medical workers. Number 7 is global demand for healthcare workers. Many developed countries face shortages of healthcare workers and actively recruit from countries like Nigeria, offering attractive packages and incentives. Some developed countries even have streamlined their immigration processes for healthcare professionals, making it a lot easier for them to relocate and practice abroad. Number 8 is the impact, the increased global demand uh, as a result of the impact of COVID-19. The COVID-19 pandemic has heightened the global demand for healthcare workers, with many countries offering better conditions of service to attract foreign professionals. The challenges faced by Nigerian healthcare workers during pandemic, such as lack of PPEs and inadequate support, have further motivated some of them to seek working conditions abroad. These factors collectively contribute to the significant outflow of medical professionals in Nigeria, which possesses challenges for the country's healthcare system at the moment, but offers individual workers opportunity for better careers and living conditions abroad. That's a wrap for today. Thank you for joining us on Head Series. We hope you found this episode both insightful and valuable. If you have enjoyed the discussion, please remember to subscribe, rate, and leave a review. It really helps us to reach more listeners like yourself. Don't forget to follow us on Facebook, Instagram, and TikTok for updates and to connect with our growing Head Series community. If you have any questions, suggestions for topics or guests would like to hear from, feel free to reach out to us on the email displayed on the screen. I would love to hear from you. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. Thanks for listening.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.